All right, and there's a belly flash, everybody. And kind of pump it. Looks like those 80s workout videos, you know. And 1, and a 2, and 3.
So the main issue that I have is my upper right, like this area right here is always tight. Anytime I sit at the computer or read, which I do both of those a lot, or drive, it gets aggravated. And if I try to have good posture, like right now I'm trying to,
Sure.
It actually is very much of a strain on my back to do that.
Does it ever burn in there? Does it kind of get...
Sometimes.
Yeah.
Usually it's just kind of like a mid-level aggravation, but there are times where it does get triggered and it's more.
Okay.
And also my neck. My upper, like really high in my neck, is always really tight.
With that scoliosis, the muscles are going to be working extra hard because the bones aren't in the right place. And, you know, it's a kind of a long explanation for what causes scoliosis because it sounds like a structural scoliosis. It's been there since you were a kid. These are essentially your spinal column. As you were growing, the spinal column was longer than the spinal cord inside. And so the spinal column has to kind of buckle laterally to alleviate stress, and the spinal cord can kind of ride that edge, and it alleviates buckling pressure or tethering pressure on the spinal cord. And so it actually has to be there. Now, with this, it always goes to the right, by the way. The heart's over here on the left, so we almost, I've never seen a left thoracic. I've seen some left lumbar, but it almost always called a dextro-levo-scoliosis, where it goes to the right over here and then it goes left. So on the right side, we call this the high side of the rainbow. It looks like on the high side, and I have a scoliosis, like I was saying, mine's about 19 degrees, and the area that you pointed to is an area that I am constantly managing, and the pain is coming from joint. That's the knuckles. So the joints on the left side are compressed, so they're not going to be filled with fluid, but the joints on the other side are going to be swollen because they're spaced open. Essentially, when you tilt to the left, the joints on the right side get separated, they get swollen. When the joint gets swollen, the nerve gets irritated, the muscles are actually trying to stabilize. So if you can kind of see on this joint, they look like handshakes. That little surface glides over that surface, if you can see that, right? So when I think of it the best as a handshake, so when we're overlapping, we have a lot of power and there's a lot of strength. But if I start to separate, we're gonna have to use more muscles to hold on to each other. Do you understand? Because our surface area contact has lessened. So on the right side of that scoliosis, because the joint is separated, there's a rubber band in here that's under stress, inflammation, muscles that are getting tight. So ultimately, you can be adjusted. And I think you said you've been through some adjustments, and it's probably doesn't last very long because
I
asked,
feel like I could go back every single day and need it again.
To some degree, with our scoliosis spines, we're going to need some level of care more than a non-scoliotic spine, but there are some things I can show you, especially at the end of the visit, involving stretching. So the chiropractic biophysics guys, these are the guys that have studied posture, how we change posture. It involves laying on our sides. This is in the lumbar, so it would be on the other side. It'd be you do this on the left. So it's like this. You put this guy, right? We'd be bending it over on the right side of your thoracic cage, and then we'd be putting on the left, on the opposite side on the lumbar. And we'll give that a shot at the end.
Okay.
But that's going to help you deal with that local pain. You also indicated that you had some numbness. Tell me about that.
Yeah, I feel like the upper right back area, I have less sensation there.
On that, right over that area.
Not that I guess, I don't know how I first figured that I might have that, but if I use like a back scratcher or something, like I have less sensation.
In between the shoulder blades in there?
Yeah, to the right of the spine.
Okay.
Yeah.
Yeah, this is my area. This is the peak of the rainbow. So because it's going over the right-hand side, this area is under a lot of inflammation. The nerves are traveling. So out of the spinal column, the nerves travel through this tissue, and so they're going to get irritated, choked, inflamed by that pressure. I doubt very heavily that there's any disc injury. Very, very commonly when someone's dealing with that down the leg, we're dealing with a disc hitting a nerve. I don't typically see that very often with a scoliosis. I find it more often in the lower back, the lower neck, an MRI would need to be taken to see if the discs are in trouble.
Okay.
The health of the disc comes from it not being compressed all the time. So if you're working desk work or, looking down a lot, that posture puts a lot of pressure on the disc, and that can injure the disc, eventually leading to the disc bulging out, hitting the nerve. I'm gonna just, like I said, go through your spine today. Let's go through, adjust it, clean it, see how your body responds, and then we're gonna actually, at the end, we're gonna test out. I love it, but the longer it's been there and the longer it's not been stretched, we wanna incrementally start going into it. I call it feeding a scoliosis. So mine is about 19 degrees, let's say something like that. I can absolutely feed it and make it larger than it would need to be. And so I find scoliosis many times, I try to bring it down to what I call baseline, which means there's a level of lateral curve that has to be there based on what I was saying earlier about the spinal cord and the spinal column, but it can be made larger than it needs to be. And so that can further exacerbate the symptoms of numbness or pain and tightness.
Also, my feet, I do notice tingling in my feet. It's not painful at all. I would say it's medium to
How long has that
mild.
been going on, do you think?
Probably, I don't even know, years, but
Where on the feet? Both feet?
I think the bottoms of my feet.
Bottom of both feet?
Yeah.
Okay.
About equally.
All right, and you've told that to chiropractors, nobody's taken an MRI of your lower back, nobody's wanted to take a picture of that? Not really.
I don't know if I've told my chiropractor that.
Okay, so when we're dealing with numbness in the bottom of the foot, we're dealing with 99% of the time we have a disc injury. That think of the disc like the enamel on your teeth. It doesn't have any feeling, and we can damage it without any awareness of it. And when that structure gets damaged, it starts to put pressure on the structures that do have feeling, like these nerves coming out the side. And when these nerves start to get hit, you're going to start getting numbness on the bottom of the foot. When you hit this nerve, it doesn't just cause, problems with the foot. It's also going to create organ problems. And I noticed you put some things on here about some organ issues, and I don't find that coincidental, that the organ issues and the leg issues are the same thing. If you have numbness to your leg, you also have numbness to your colon, or you have a numbness to another part of your body. And so the function of your organs is dependent on these nerves also, because when this model, if it kept going, this nerve bifurcates around here. It actually goes into two branches. One branch goes to your muscles and your skin, and the other branch goes to an organ. So because it gets pinched before it bifurcates, both branches are affected. So curve can't be created or destroyed, and sometimes curve will go into scoliosis because we lose this curve and it goes into a lateral curve. Does that make sense? So part of restoring your neck curve is taking it out of this area, right? So we're going to try to reduce this and actually put it back in your neck, because a lot of the tension, inflammation, ringing the ears, jaw, these are all, they're not coincidental. These are connected to the health of your neck. But if there's not much curve in your neck, the fact that you say it's uncomfortable for my neck to be curved, many times that happens because there's injury to the joints, the tissue in the backside of the spine that has a lot of feeling. And so it's like, oh, now I don't like it. So somebody needs to go through and clean this tissue so that we can actually start to go into it and then stay there and stretch your neck back to being curved.
But I have really limited mobility this way.
Yeah, so
More so on this side, like I can't tip my head very far.
So part of that is a scoliosis. So if I'm going to exaggerate a little bit, but because it goes on the right side over here, essentially this is what we like to do. Does that make sense? Our head follows that scoliosis. So that right bend, our head wants to go left. Does that make sense?
Yeah.
So we're already in left lateral bending. We're really good at it.
Yeah.
Right? We're not good at right lateral bending because that pushes the scoliosis. That's connected with your back. And so it's first about freeing up your spine, making sure the whole spine works, and so we don't pinch anything. When we tilt and bend, so for instance, when I bend forward, that hole gets bigger, right? When I bend back, it gets smaller. When I bend to the side I bend to, it gets smaller. So if I bend the spine to the left, the hole on the right gets bigger, right? So mechanics, this is what we call chiropractic biophysics, the mechanics of your spine have the ability to affect the size of that hole, pain. Take a deep breath in for me. We'll sit up for me. And then let all the air out. Exhale. There we go. Deep breath in for me. Let all the air out. Very good. Deep breath in for me. And then exhale. And it all go. Good, stay there. Hands around your belly. All right, take a deep breath in for me. Exhale. I got you, you're okay. Breathe in deep. Exhale. All right, other side for me, good. Exhale, just see it. So face up for me, it's okay, face up. We're checking the SI joint. The purpose of that side posture is to make sure the joint below your lower back is moving. So the segments right above your sacrum are the ones that cause that numbness in your foot. Like for instance, your right hip was moving, the left hip was pretty tight. And you think the numbness is even on both feet?
Yeah.
Okay, interesting.
Like right now, I guess maybe possibly the right foot's a little more tingly, but.
So when your head's straight to your torso, I feel like there's a big bump here on the right side. This is again part of the scoliosis. That extension of the thoracic right curve creates a left head tilt, which makes the bones all pop out on the right. This is going to be something that we have to not only get your neck loose, but also stretch and kind of push that right curve in if we want to attempt to reduce this. Real easy. It's okay. Okay. There we go. Okay. All right. You okay?
Good.
All right. I got you. There we go. Yeah. Okay. This area is going to be kind of like a pocket that needs to be worked on, and I don't believe that a scoliosis has been here this long can be completely removed, or at the very least the conversation should be to try to figure out where baseline is. How do we know we've reached baseline? Well, usually if you try to keep straightening a structural scoliosis too much, eventually you start getting headaches a lot.
Oh, really?
Because the brain starts to get pulled into the neck. We call that spinal cord tethering, and so that's kind of the first indication that we can't go any farther. I tested this on myself. When I try to straighten my curve too much, I get my neck and that spinal cord they shown with people with MRIs that have had their spines operated on and straightened their scoliosis, that the brain's actually tethered and pulled into their neck.
Wow.
Not a good place to be.
Yeah.
We shouldn't be trying to just straighten structural scoliosis. Our spinal column is too long relative to our spinal cord. So essentially it needs to be there. You're saying some semblance of it needs to be there, but with it we need to understand that the joints in your spine are going to be upset because of that lateral bending.
Definitely feel it.
Mm-hmm. These are the roots of the neck down here. These are just the other end of the same muscles that attach on the occiput. So the ears drain, the drain lines, the lymphatic drain lines that drain your head, skull, ears, all drain through here. So when you have tension in your neck, it's going to affect the, like I said, the drain lines, and then that affects and inflames the organs. Sinus issues, jaw issues, ear issues, they're all on the same circuit.
That makes sense.
So we show you the curve. I got you. It's okay. Head back. I know. Gonna feel a little awkward. This is where your neck belongs. We want to,
Don't feel natural.
Doesn't feel good, I know. So they make a retainer that I'll show you at the end of the visit that holds you in a, similar to this. It emulates my hand.
Mm-hmm.
The goal is to be worked on to the point where it isn't, excruciating or very, so you can hold this for actually 20 minutes. You have to actually stretch this position for 20 minutes to get your body to want to stay here. Have you had anything like gua sha before? No, not so much this.
No, I actually, because of watching the videos, I tried to find somebody in my area who did that, and I couldn't, but I did find a chiropractor who does cupping, so I've had some cupping done over the last several months, but it's hard to do your neck.
Yeah, no,
more,
I can tell that nobody's done this before.
Is it pretty red?
Just from that. That was extremely mild.
Yeah.
It is very, very red.
Came up quickly.
Very quickly, and it's the stagnation, kind of dead blood that gets trapped in these tight areas that inflames the tissue. This mobilizes it, gets it out of there, gets it away from the nerves. Yeah, it's
Yeah.
pretty. I'm going pretty gentle, right? This is not. I'm not going hard. It comes out real dark, even with just light pressure here. These are just soft. These are like vacuuming. I'm just vacuuming. It doesn't keep people from taking their shoes off at the front door. You want to first train people to take their shoes off the front door so don't keep tracking mud in. But you can vacuum and sweep and clean. But the curve in your neck will make the need to do this less. The more arch that's in your neck, the less tension that will be here, the less need for this. Right? So you're saying I should get gua sha every day? No. I'm saying you should stretch your curve back into your neck so you don't need to be adjusted that often. So you don't need to be gua shas, you don't need to be cupped. And there are tools that I can try to show you that you can use to, brush your own teeth kind of idea. And you shouldn't have to have constant, every other day chiropractic care. It's not really what the goal of this is. I want to equip my patients with tools. When it gets this built up, sometimes you need help to get through the forest.
I'm sure.
Okay. But yeah, the goal is I work on 80 or 90-year-olds. There is no level of normal soreness. There is no level of apprehension that should be in here. You should be able to handle quite a bit of pressure, you understand, and still be able to breathe through it, right? The restriction and tightness in here makes it feel like I'm pushing really hard because a rock's meeting a hard place, where my hard elbow is meeting the stiffness in your back. Now, if your back complied and was loose, well, then you wouldn't have numbness in the bottom of your feet. The tightness in your middle back allows the lower back to overstress. So we have to mechanically divert stress away from your lower back. There we go, you're fine. Get it off the lower back. There we go. For every, overworked area, there has to be an underworked, kind of a yin-yang. So my job is to find all the underworked areas. The Thompson drop piece, I don't know. I don't, they're trying to realign the hips, but the crookedness happens as an effect of the nerve pressure. It's not the cause of the nerve pressure. We need to unlock all this. This is all the high side over here. To some degree, we're going to need some level of care in here. Maybe once a week massage in here on the right. You understand? This will need some level of care because of the position it's in. I believe that if we can make the stretching workable, that your need for that will go down dramatically. And that's how we can, take care of you long term. But yeah, there's quite a bit of tension in here. It doesn't surprise me that the nerves are irritated. I would suspect there's going to be a pretty good gua sha mark right here. I feel quite a lot of restriction in here.
I just recently started using a roller ball, foam roller thing. And just to roll like face up.
Yes.
I can't go too low in my back because I just can't hold
Work the
like
chest,
that.
work the chest area. Yeah,
But I
that's good.
do, like the mid and upper back.
Good,
And
good.
I can do it like 3 times a day, or I could do it every hour, I'm sure, and still hear cracking happening. But
We want to get to
it
20
does
minutes.
help a little.
The goal is 20 minutes total. Eventually your head touches the ground. It's not to say that 2 minutes is bad or 5 minutes is bad, but we want to actually get it into being a stretch versus so much an active exercise, meaning you're holding the position for a longer period of time. But yeah, it's a great
That's
way.
interesting. I actually don't, I do it probably for like a minute because
I understand.
I know that I'm just going to need it again in
Mhm.
an hour after sitting at my computer.
Right. Anytime you're approaching 20 minutes in any position, you're changing your posture. So if you sit for over 20 minutes, you've just changed where center is slightly more forward. To counteract that, we have to counter stretch you and then hold you in the opposite position for 20 minutes also. That's not to say that 1 minute or 2 minutes is not beneficial, but your posture isn't going to change, right? So where your alignment can't change with just doing a 1 minute. Now, many times patients will start off at 1 minute and we, over a period of a month or two, work your way to 20 minutes. But this, when I show you a picture of your back in a minute, you're going to see all the reasons back here that you're desiring to clean.
Yeah.
This is all of this is just inflammation that's been trapped in here.
Ow.
Sorry, I know. Maybe use hands. So there's not been any soft tissue work up here, obviously? Nobody's
No,
done?
I mean, I've had massages in the past, but
Okay.
not consistently.
Okay. I use the soft tissue work as a way to, make the tissue not, so you can hold a stretch for longer. When the tissue is this inflamed, you're not going to be able to stay on it for more than a minute or two.
Mhm.
We've got to dramatically change, the composition of the tissue to a point where it's not so acidic, inflamed. This is where I yearn to be worked on myself, right in here on the right. This is, I don't know how long, like I said, you're going to need to have some level of, more than any other area right here on the right, is going to need to be worked on. I think when we stretch more and more, you won't need it as often, but, You're doing great, though. You're doing great.
Yeah, I do this like a 30-minute yoga routine
Mhm.
sometimes, and I can tell the difference from the right to the left, leaning
100%.
side to side.
I'm with you 100%. So when you're doing a yoga class, I wouldn't go any farther on your good side than you can on your bad side,
Oh,
right?
okay.
So but I can make a really beautiful left half moon, but I suck at right half moon, right? Well, then you can't go beautiful left half moon anymore. Do you understand?
Okay.
Because you're further imbalancing your spine.
Yeah.
You only go as deep to your easy side as you can on your bad side, right?
Yeah.
And I'd almost want to do like an extra rep to the right, right? So if you did like 2 each way, then I'd do like 1 extra one before you
Mhm.
finish into Savasana, you go into a right, because you really want to spend more time and more effort confronting the weak side, the side that doesn't want to be compressed. Otherwise, you can get into a problem where you're further imbalancing your spine, because the side that's loose will get looser than the side that's stiff, right?
Yeah, that makes sense. I
So
would never
even though
thought
you're
of
doing
that.
this thing that's good for your body, it's like, well, if you're doing it evenly, you're probably not doing it evenly, because you're actually, the side that's loose is getting looser at a higher accelerated rate than the stiffer side's going to get loose. It's a pretty significant amount of, lactic acid inflammation. The mobility of the joints wash the tissue, right? So when you have, that's why when I rub there, you're going, whoa, there's a reflex. Yeah, this is what's causing all those reflexes. This is all, inflammation that's trapped in there. We want to teach you how to do things like this. And the roller is a great scanning tool, but we got to do it for longer, or at least work our way to doing it. This is what they're trying to use the Thompson drop table on. I find it better to, I want to be careful to not upset L5, right? So we want to loosen this joint here without loosening L5. And it's just when we use the drop table, I feel like the specificity goes down a little bit, right? Kind of the force goes sometimes where we don't want it to go. I want to be careful, especially you have numbness in the bottom of your foot. Let's not do anything to upset L5.
Ooh, that's more sensitive.
Right in there. This is what they're trying to adjust when you're doing the Thompson. We're trying to loosen this joint. There's a largest joint in the body right here, and it's necessary for this joint to be working optimally for the health of your lower back. So when this joint gets stiff, sitting stiffens this joint, the lower back gets overstressed.
It tickles.
That's common. You're like, that's really too much.
I feel like pizza dough.
Mhm. Okay, I got you. I know. Okay. I know that's the toughest area right there. I get it. A car nut, and there's something called an impact gun. You know, the impact is, you know, applying a torque on the bolt, but then it gives it like a little bit of a jolt. Makes sense? It's it's like, so that's what the adjustment is. It's like you hold, and then a little thrust is like the impact gun. You're trying to break loose that coefficient of static friction to get the bolt to start turning in the same way the vertebrae need to be moving. Any car mechanics out there will go, oh, I got it. Now I understand the thrust. It's like my impact gun. No ears have come off yet. I got you. Go ahead and tilt your head to the right for me a little bit. Tilt right. Okay, it's okay. Go
I'll be
easy.
so let down if my ears don't.
Oh, we'll get
do
it.
that.
Tilt to the right.
Oh.
Yay!
It worked.
That's a good one.
Here we go.
Tilt to the left.
1 second to keep your head straight.
Oh.
And then 1 second. Okay, go ahead and tilt now. Okay, from the bottom. Tilt one. Okay. Go ahead and tilt to the right. Left. Nothing there. Okay. You did good. See here.
I want the works.
It is straight traction. Any of the joints in the hand, they just. Here. Okay, nice.
Yesterday I hit this elbow really hard on that bone right there, so
On this
it's
table?
fine now, but I'm wondering if I.
A little bit.
No.
Start right over that numb area. Right, and there's a belly flash, everybody. So the idea is to actually stretch to the right. I almost take this left wrist and I pull. You want to feel a stretch all along the left side of your body. And eventually that block won't even need to be there, and you're actually deeply stretching to the right. You're going to feel a strong desire to round forward, to round and curl forward on it. You want to kind of stay over to the right side and actually on the back side.
Okay.
So it'll be more difficult here. It's to make it doable, we're going to put the blocks behind your head to make it not so excruciating, but this isn't fun. I don't particularly, you get normalized to it and it gets easier the more you do it. I do like to kind of rotate a little bit. I do, but it's uncomfortable. It hurts on the right side is going to hurt. It's going to feel so good when you get off, but I feel more just some pressure on the right side. I don't feel pain anymore, but there used to be more pain on the right when I did this.
Okay.
So on the left side, we're going to go the left lower. It's going to be right above your iliac crest. Does that make sense? And then sometimes another way you can do it is you actually have your legs straight. You actually can kind of pump it. Looks like those 80s workout videos, And 1, and a 2, and 3. Anyway, so you can. They say about a set of 10 times. You're kind of trying to work it into the left side here. I know.
It just feels like it's hitting that one spot.
On the right side, yeah. You got to work it.
Ow. I mean, I can't even relax down onto it so I feel like I'm tensing, if anything.
We might be too early for this. It's
Yeah.
You want to be prepped.
I'm trying to relax, I can't. Right spot?
Same kind of spot, right? We're trying to hit that, yeah. I got you.
Yeah.
She's like,
This
it
is
feels
not
so
better.
Yeah. We might start with just, see how the right side's higher here? See how this arm's higher on the right? It's because that right
Oh,
shoulder's more
yeah.
forward.
Yeah.
You want to stretch and work all these angles. So you might have them to the side like that, but you want to work all these angles in your shoulders coming back, and actually using your left arm to assist your right arm, so you would, make sense? And you're trying to bring this right arm back. You can kind of emulate the side a little bit by rotating your knees, so you bring your knees to the right. And that kind of,
Yeah.
I know, yeah, that kind of emulates laying on your side a little bit. There you go, and then bring your knees left.
I think I actually
Good.
heard something crack.
Good, yeah, it's good. No, you want to do this yourself at home.
Yeah, I can go a lot farther this way.
Correct, yeah. So I want you working on that right side.
Oh, that's right.
That compresses that right side that needs to be compressed. The bent spine actually gets, when you pull it from both ends and it pulls it straight. Again, our spinal cords aren't long enough, so you're going to reach a point in rabbit where it's going to start causing headaches. If you're going too deep in it,
Too much.
I do. Like for 8 hours, I'll have a headache really bad when I'm like no more flexion, but it's trying to figure out where that baseline is. Mine's about 19 degrees. I don't know. We would know it pretty quickly. You know, it wouldn't just be that pressure pain. You'd actually start getting, I'm getting a headache here, Ed, laying on this. Got to back off. And but there's that joint. You can get a lot of benefit just by getting your spine adjusted and massaged, getting that bruising out. It's going to be, a couple days that bruising will go away. But if we don't work towards these type of stretches, it gets depressing. It's back again, Ed, and this will make it so you maybe only need to be worked on every other week or every once a month. Your need for care will go down versus I got to get worked on 2-3 times a week. Whatever you want to do. I'm just saying that's the goal with why we're bringing this into it.
That's good.
Feels good?
Yeah,
All right.
doesn't hurt.
Wonderful. You did great. Thank you so much. Thanks for dropping in. Thank you.
Very much.